morning. It's Friday, March 12th, so it must be time for another legislative update from your North Carolina Medical Society. This week, we've continued those appropriations committee meetings that focus on different healthcare topics, but not just healthcare, agriculture, finance, local government, a variety of topic areas. But for the health committee, this week really focused on public health and our local health departments and some funding needs that are there. As a reminder, the Medical Society is supportive of the local communicable disease funding that would allow more funds for our local public health departments to better track and analyze communicable diseases. So we're still advocating for that bill to be included, or that appropriation to be included in the final budget process. As a reminder, we're in long session, which means that we're still undergoing conversations about the budget. This will be the year that a budget does take place, or at least is filed. So we'll continue to update you on that as we continue to hear more. But if you're interested, that information is available online so you can see and learn a little bit more about the current status of our appropriations in health that relate to healthcare. The next bill I want to point out to you is House Bill 93. We've talked about this before. There are a lot of discussions on this. As a reminder, so many of your specialty and county medical societies signed on to our opposition letter. I think we're at over 30 signatures on that letter. So thank you if your county or specialty society participated on that. That really adds great strength and weight to our opposition. We also will be getting a letter from the AMA to announce their opposition to this bill as well. And because of that, we've also sent out an action alert that over 800 of you participated in that sent emails out to your House and Senate member. And because of you becoming engaged and you acting on that action alert and communicating with your legislators, many of the bill's sponsors who misunderstood, I think, that what this bill really did have pulled their names off, or even in committee this week have said out loud that they did not understand the full picture of what this bill really does. So unfortunately, the bill did make it through the insurance committee in just an odd procedural fashion. So now it will move to the healthcare committee. So continue to reach out to your legislators on this issue, because we want to make sure that your voices are being heard about why prescription mandates are bad and why physicians and PAs across the state are opposed. The next bill I want to point out to you that was filed this Thursday is House Bill 277, Senate Bill 249, the SAVE Act. So this is the same nurse independent practice bill that we've seen for the last couple of sessions. It was filed Thursday. They had a press conference with some other organizations. As a reminder, this bill would allow independent practice for certified nurse midwives, certified nurse specialists, nurse practitioners, and certified registered nurse anesthetists. So all of those nursing groups would have independent practice under both of these bills, one filed in the House and one filed in the Senate, were they to move forward. So feel free, continue to reach out to your legislators on this issue too, because over this weekend and into next week, the bill sponsors will be asking legislators to sign on to this bill to sponsor it. So again, reach out to your legislators, let them know how you feel about this bill. We'll continue to monitor this closely too. One other public health related bill that I do want to mention to you, because I think this impacts the entire medical community, is House Bill 272, which would actually revise standards in terms of lead, in terms of parts per billion that could be allowed in water. This would actually update and revise our standards in a good way from 15 parts per billion to 10 parts per billion. So this is something that we'll be following closely as well. And I know matters a lot to our pediatrician community and how lead can impact children, but also the entire medical community and our public health partners. And finally, I want to say thank you to NCMS board member, Dr. Holly Biola, who organized our first White Coat Wednesday with some preventative medicine residents at UNC. This, I think, is the third year that we've hosted them. A great group. We talked a lot about equity and public health and a number of other related issues, but it was a joy to have them. So as a reminder, you can register for our White Coat Wednesdays online. However, now that we're in a virtual format, we are expanding that to other times and days based on your availability. So please reach out to us if Wednesday doesn't work for you or you'd like to do another day. We can certainly make that an option. I know some groups have already reached out to us, so thank you. We're happy to set those up. As a reminder, you may not hear back from me. I do have another staff member who's helping me coordinate and organize those. So just so you're aware, it may not be me reaching back out to you, but we do have another staff member that's helping coordinate those times and meetings and Zoom links. So you may hear from her too. Well, that is all I have for you this week. I hope you have a wonderful weekend and enjoy the sunshine that is going to occur this weekend. We look forward to talking to you next week.